Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of the series, we will discuss ADHD in relation to neuronal hyperexcitability. Attention deficit disorder, better known as ADHD, is a common, genetically based neuropsychiatric condition that affects a larger fraction of the population than previously thought. Although the disorder classically involves a triad of inattention, hyperactivity, and impulsivity, some children may only experience one or two of these symptoms. Also, the symptoms may wax and wane in severity depending upon the child's general level of stress and degree of interest in whatever he or she is doing. Poor academic performance, disruptive behavior in class, and a failure to complete homework assignments are common indicators that a child has ADHD. Although the disorder is lifelong, it is most commonly associated with childhood because the symptoms tend to be most prominent and most noticeable during the school-age years. Although ADHD is broadly recognized and treated as a distinct diagnostic entity, there is growing evidence that it is yet another manifestation of the hyperexcitable brain. Like all the other psychiatric disorders that we believe to be rooted in neuronal hyperexcitability, ADHD is genetically based, exacerbated by stress, and cyclic in nature. Also, the severity of ADHD is strongly correlated with the severity of the psychiatric symptoms that commonly co-occur with it. With few exceptions, what appears to be happening in ADHD is that the hyperactive brain is spamming the mind with distracting messages. The symptom of inattention occurs when the overabundance of neurosignaling causes the mind to become distracted by extraneous thoughts. Similarly, impulsivity occurs when the overabundance of neurological activity stimulates more thoughts than the brain can process before the mind acts on them. The third symptom in the triad of ADHD, physical hyperactivity, is just an external manifestation of the hyperactivity that is occurring internally. All of these phenomena can likewise occur in normal persons during times of high emotional stress, when the brain naturally becomes hyperactive, an observation that adds further support to the idea that ADHD is not caused by a broken brain, but by a hyperactive brain. The means by which psychostimulants such as Ritalin and Adderall improve focus is by enhancing the brain's ability to regulate the signals that it is sending to the mind. The problem is that they do this by a stimulatory mechanism, thus contributing to the underlying problem of neuronal hyperexcitability. Also, because they increase dopaminergic transmission, they tend to create a mild euphoria. This, together with their energizing effect and rapid onset of action, is what creates their addictive potential. The stimulating effects of ADHD medications also helps explain why they have a propensity to cause anxiety, irritability, and insomnia. In recognition of this, their use should be minimized and, if possible, avoided. A more conservative and healthier approach to the treatment of ADHD is to simply reduce the level of excitation in the brain. This approach also helps alleviate many of the symptoms that commonly co-occur with ADHD, such as anxiety, irritability, and moodiness. Natural ways to do this include stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. Although the traditional non-stimulant medications clonidine and guanfacine may be helpful in this regard, they tend to lower blood pressure, which may not only be a dose-limiting side effect but may also increase their dangerousness and overdose. Much safer, more tolerable, and more broadly effective are anticonvulsant drugs such as gabapentin, oxcarbazepine, topiramate, valproic acid, and others. The benefits of calming the brain explain why alcohol, marijuana, and benzodiazepines, all of which are potent anticonvulsants, are so widely used and abused by persons with ADHD and other psychiatric disorders. Unlike these addictive drugs, pharmaceutical-grade anticonvulsants are relatively safe, non-addicting, and longer-acting. If these are either ineffective or only partially effective, then a catecholinergic antidepressant, such as bupropion or atomoxetine, can be tried, as these are much less activating than psychostimulants and they, like pharmaceutical-grade anticonvulsants, are non-addictive. If, as a last resort, a psychostimulant is needed, then combining one with an anticonvulsant can help prevent the psychostimulant from upsetting the excitation-inhibition balance in the brain, thus preventing many of the common side effects of psychostimulants and helping optimize their effectiveness. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in the series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be of benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.